Good afternoon. My name is Rich Beck, Allen County Commissioner, and on behalf of my fellow commissioners, Therese Brown and Nelson Peters, I want to thank you for coming here this afternoon. This is a continuation of the news conferences we've been holding, where we're trying to tie our constituents to the resources available to them during the COVID-19 crisis that we're experiencing. As you recall, there was a survey done by the Merrill Institute and give us a lot of information, and it identified the issues that the community is dealing with. And one of the topics that came up was mental health. And so what we decided to do today is bring the experts in to talk about the resource that's available to you on that. You know, a small percentage of the population has been affected directly by the COVID-19, but the rest of us have all been impacted by it. You know, we started with a virus that is very contagious. It has no vaccine. It has no cure. And we're dealing with that. And we're dealing with it in several different fashions. We have quarantine. We're working at home. We're staying away from each other. And all of those things create stress and anxiety in our lives because it's completely turned our lives upside down. And it's critical that we all understand that we're in this together. So it's not just one person, it's all of us that are upside down in our lives. And that's going to create some anxiety. So what we want to do today is bring the experts in to talk to you about where's the relief, where do you go for help, what can you do to resolve those issues. But prior to introducing our speakers, I want to turn it over to Mayor Tom Henry for his comments this morning. Mayor?
Thank you, Commissioner. Good morning to all of you. Actually, good afternoon to all of you. The Commissioner was absolutely correct in saying that during these times, we're all going to struggle with a significant amount of anxiety. And what brings this all about? Well, just think of the subjects that we've talked to you about over the past few weeks and those that we've been exposed to. Our own physical health and well-being, the availability of food in our community, the availability of shelter, transportation needs, employment needs, access to money, access to proper clothing, the educational environment. These, among a number of others, have put a lot of us in a state of significant anxiety and angst. There are those in this community who take those subjects, and challenges on in order to help us cope during this time that is unprecedented. And that's what today is all about, is making sure that the public is acutely aware that there are people and organizations in our community who are out there to help them through these troubling times. So with that, I want to thank the Commissioner for allowing me a few minutes to share with all of you that we do have help in this community. No one in Fort Wayne, no one in Allen County needs to feel alone. It's a lonely period for many of us, but you're not alone. We're there to help. Thank you. Thank you, Commissioner.
Thank you, Mayor. So what they've said is correct. We're experiencing an unusual time, and so the added stress and anxiety that we're experiencing is going to be normal. The important thing for us is to think about what our mental wellness will look like now and into the future. So that means working on prevention as well as early intervention. And you're going to hear in a few minutes from other providers who have the services that you may need currently or in the near future to deal with the implications of the COVID-19 virus. We want people to plan on their mental wellness. And we want them to stay healthy. So what can you do to mitigate some of the mental health complications that will be affecting you and your families? One is stay on a routine. I think we've all heard that as an important part of staying well, and that's just always on the top of my list. Also taking breaks and exercising, sleeping well, eating healthy, those common things that we should be doing. And we think about this time as we isolate in our homes and we're spending time maybe resting a little bit more is to think about what habits we can now incorporate into our lives so that everyone is healthy in our life. Join support groups. Our organization has a couple of support groups on anxiety and depression virtually, as well as wellness recovery action plan courses. We also have some training so you can learn how to be more supportive for others who might be struggling with their mental health. And we're working with the Division of Mental Health and Addiction in Indiana to provide additional supports across the state. So there will be more resources available at a statewide level. And, just doing those simple things about talking with your children. They are also being impacted by this circumstance. And there are some resources on our website that are available on how to talk to your children about COVID and what they're going through and their separation from school and their families. We also have some Facebook groups that might provide some added tips and ongoing videos that might help you along the way. And so you can go to Strong Parent Lounge as well as Connecting Teachers for ongoing resources and chats. And also on our website is screening tools. So if you're really unsure about how you are doing on your mental wellness, you can take some screenings there also on our website. So that's mhanortheastindiana.org. Thank you.
Thank you, Lisa. Appreciate that.
Good afternoon. I just want to thank everyone for the opportunity to speak with you today about mental health in our community. And I just want to echo many of the things that Lisa shared, great ideas for how to manage some of the additional anxiety and stress that we have. I just want to speak to you a little bit about some of the ways that we have modified our service delivery at Parc Center at this time in order just to make sure that we are protecting the safety of our clients as well as our staff. So we do have our inpatient, our addictions residential, our adult and adolescent group homes, and all of the cluster departments that we serve continue to be 100% operational at this time. We have made some changes to the visitation that we do with family and support systems, and we're using video platforms to still engage the support systems that are there. Our outpatient therapy and medication services have transformed to a telehealth platform. And so we are doing services through video and audio technology at all of our offices based on the capabilities of the client that we're working with at the time. But we've also maintained all of our operations at our location, so we still have the capacity to serve individuals at site if needed. Those services are available at 1909 Caruth Street, 909 East State Boulevard, and 2710 Lake Avenue, where our walk-in clinic is located and is able to meet the mental health needs of the community. We're continuing our home and community-based services. We have transitioned predominantly to telehealth, but we are still going in-home and on-site when those services are necessary for safety or for the best treatment of the individual. We have also modified all of our locations to allow for service delivery rooms to be located near the main entrances. We've deployed iPads to all of our locations so that we can also do telehealth on-site. And all of our on-site services now are following the prescribed protocols to monitor for symptoms and to limit face-to-face activity as much as possible. Above all, we want the community to know that we are continuing to serve all of the existing clients that we have at Parc Center, as well as we're still taking on new clients at this time. Anyone who needs to access services can contact our call center to schedule an appointment. That number is 260-481-2700. You can also contact the 24/7 helpline. That phone number is 260-471-9440. One of the supporting values of our organization is that behavioral health challenges no longer stand in the way of the vibrancy of our community. We know that this current pandemic has created some barriers and some challenges in that way. And so I think it's normal at this time, as Lisa said, that we're all experiencing some anxiety and stress and maybe some trauma from the events that are ongoing. Some normal reactions that you might be experiencing would be to have worry that's difficult to control, maybe some mood fluctuations, sleep disturbances, physical body aches, an increase in substance use, and changes in your focus and concentration. Lisa had already spoke about some of the resources available through Mental Health America. Others will speak about the other services that are available in our community. But we also want you to know that there are some good mental health tips that you can do right now for yourself at home. Some good mental health practices that have already been mentioned: keeping a routine, organizing your day. We want everyone to pay attention to nutrition, the things that you're putting in your body, as well as your sleep, when you're going to bed, when you're waking up. Try to limit how much time you're spending on social media or scrolling through news feeds, but also at the same time, maintain social connectedness with those around you through phone calls, text messages, and video chats. One of the goals that we have at this time is that we want to be able to maintain that physical distance that's been recommended to us, but also maintain our social support systems. This is certainly not a time that we want to isolate from those around us. One thing I do want to talk about is just our children and adolescents in the community who may be especially impacted by the anxiety and stress that's going on right now. Most of our children and adolescents are going to have a limited understanding of what's happening, and they also have less control of their surroundings. We want to keep in mind that this is not vacation, it's not an extended spring break, and that children might act out behaviorally or experience increased periods of hopelessness and increased agitation. Reach out for services to help you learn how to talk with your kids about COVID-19 and have those age-appropriate conversations. Parc Center is here. We want the community to know that we will continue to be here, both in person and through telehealth. If anyone in the community would like to talk with one of our therapists, we'd be more than happy to coordinate that. If someone would like to talk to a doctor on the phone or through a video chat, we'd be more than happy to set that up as well. One of the positives that has come out of this and our ability to use telehealth is that many of the barriers that previously existed in accessing services with transportation and challenging schedules have certainly been reduced with our ability to use telehealth platforms. So please reach out for services as they are available to you. More than anything else at Parc Center, we want you to know that we're in this together as a community, that we will get through this. We want people to know that they are not alone. We know that we're better together. Thank you very much.
Thank you very much, Laura.
Good afternoon, folks. It is a pleasure for me to be here today representing the Bowen Center and all of the really caring providers we have. I think my biggest message, we've already received tons of really good guidance from the other folks that spoke, but I think my biggest guidance would be, don't feel or think that you need to do this by yourself, or that there is not help out there, or that you should just stay strong and stay firm. Help is available. It's more available now than it's ever been before. I am so excited with the way we're able to serve now, and I would say we have an entire workforce of therapists, skills coaches, nurse practitioners, psychiatrists that love caring for people. They love interacting with folks, and they love giving people guidance and support in everything that they need. It's as simple as picking up your phone and making an appointment. We have all kinds of services, traditional mental health services for individuals. We have, even our groups are now on virtual. We have services for the itty-bitty little ones. Obviously, we have to be really creative, and our therapists are so wonderful at being creative. Obviously, you would imagine you can't sit a 5-year-old down on a couch and have a 45-minute session saying, how do you feel about that? That is really just not going to work. So we're just being very creative now. We can do 10-minute or 15-minute check-ins a day, or 30-minute sessions. Really, it is. We can do pretty much anything we need to under the current circumstances to help you and your family be successful and to stay safe. You're doing this from the safety of your own home. You don't have to be worried to be that you will be exposed to anything. So my message definitely is, if you need medication, call us. If you need therapy, call us. If you're a parent that's struggling with trying to work from home and parenting at the same time, oh my goodness, that is so tricky. I am a mom of a 5-year-old and a 2-year-old, and some days I think my hair is on fire, but you know what? We have folks out there that can help you. Again, there's medication available, there's therapy services available, there's skill services available. If you have family members that are in other parts of the state, we have opened up. In the past, we could only serve locally because you had to depend on finding a way to an office and seeing somebody in an office. You don't have to worry about transportation. We are available. We're there for you. And please call on us. So you can reach the Bowen Center by contacting us through our 800 number. It's 800-342-5653, and our web address is bowencenter.org. Thank you so much, and stay safe.
Good afternoon. Headwaters Counseling has been around in this community since the 1870s, and we offer an outpatient program that deals with either mental health and or substance abuse issues. One of the challenges in this time right now is a lot of the information that people have shared already is very, very accurate, is that the substance abuse issues are coming out a lot more than what they had before. The lines are at the liquor stores, it seems like. So one of the things that's real important at this time is the ability to have like if you have a computer, it's not working right, you want to reboot it. We're all trying to take care of each other. We need to reboot ourselves to make sure that we're doing what we need to do. One of the challenges with that is that if we don't take care of ourselves, we can't take care of anyone else. So as mentioned earlier, we're not alone. There's a lot of resources out there. We've gone completely to the telehealth. Our office is also open during the day, Monday through Thursday, for people who do need to come in. The ability to be able to access services, as mentioned earlier, is phenomenal because of most insurances are covering it. If you're Medicaid, there's no charges at all for most of the Medicaids. And then we also base fees on household size and income, so if people don't have coverage, especially now with the economic issues, that we can see them for little or no money. So access our services, it's 260-744-4326. We are taking new patients. We're also seeing all of the patients we've been seeing before. And if you need help, please let us know. Thank you.
I didn't want to touch the podium, but I just want to take care of everybody else. So I'm sanitizing, okay? You're welcome. Unlike the others before us, the Lutheran Foundation is not a service provider. We have Christ at our center of what we do. And so what I want people to know is that your faith is really, really important right now. We know that God has a plan for all of us, and we trust in that plan. We have a website, lookupindiana.org. We just relaunched it. On there, you can find all kinds of resources. You can find the people that can give you help. So don't call us, but if you want to text to chat, you can do that 24/7. You can web chat 24/7. And my final message is there is hope, and we will get through this together. Thank you.
Thank you, Mayor. As a psychiatrist, I've observed a social atmosphere that's created a perfect storm for a lot of mental health disturbances like anxiety and depression. And there's a lot of factors that are behind that. For one thing, we have this disturbance in our jobs. Are we going to have jobs in the future? And along with that, are we going to have difficulty with finances? So there's a lot of uncertainty about that. There's the social distancing that some people have, unfortunately, led to social isolation. And we've known for decades that social isolation is a key component and an exacerbation of mental health disturbances. So the social isolation is a factor, but on the other hand, some family members need to be closer to individuals, and that's causing some tension that was already there. So that's a factor for some people. We have the lack of daily structured activity if we're laid off. So if you don't have productive work to do day by day, you wonder, what am I going to do? So that leads to maybe getting up out of bed at different times every day, going to bed at night at different times every night, and thereby having a disturbance in your circadian rhythm, which is often a disturbance in itself. People are more prone to stress eat and drink alcohol and use various substances of abuse during this time of lack of productivity. They can be finding that they're just worried more. We're in the presence of an uncertain and an invisible pathogen that has an unknown shelf life. We don't know when it's going to leave. It's going to leave sometime. But it's kind of like an unwelcome house guest that just kind of hangs around, and you really don't want them there, but you know they're going to leave eventually, but they're still there. And that causes a lot of stress and tension for us. Many people already have anxiety and depression. People have, for instance, obsessive-compulsive disorder. As part of their condition, they are compulsively hand-washing. Well, we're telling people to hand-wash more now. So that could be a factor in worsening their anxiety. And unfortunately, we've known for decades that the month of April is a month where you have one of the highest rates of suicide for the whole year. Now, Dr. McMahon tells me that so far in Allen County, we've not seen the higher suicide rates. Thank God we haven't seen that, but it's a factor. So with all that in mind, with all these stresses that can contribute to more depression and anxiety, there's the perception that there's a lack of mental health access, because when you go to a doctor's office, the physical building might be closed. But I want to emphasize that mental health clinics are still doing business in some ways stronger than ever. So with every crisis, there comes an opportunity. And the opportunity we have is what you hear with telehealth. Telehealth, we also call it telemedicine, is basically where you pick up a smartphone, and 80% of us have a smartphone. You pick up a smartphone and you talk to your clinician, your psychiatrist, your psychologist, and you talk to them on your smartphone. And we talk to you by our smartphones or our tablets, and then we're actually seeing you as a patient. I love the technology as a psychiatrist. This new technology with telemedicine just puts a fire in my belly, because I see us being able to revolutionize access to mental health care, because you're not coming to me, I'm coming to you. So it makes it real simple. You're not having to schedule an appointment in my office where you have to be at my office at a certain time. You contact me through the smartphone or through a tablet, and I'm able to talk to you. And as a matter of fact, more often than not, due to the convenience and the confidentiality of the telemedicine, I'm talking to you in your home. And you can show me around your house. You can show me the garden you've started, the garage you've cleaned out because you had this time on your hands. You can actually show me all your medications you're taking, so there's not that uncertainty about what medications you're really taking. So for me, it's like a house call. Back in the old days, we used to do house calls, but this is like a house call, but it's a virtual house call. It's been phenomenal technology. Many of our organizations have embedded it. At my organization at Parkview, we've actually embraced it. My office alone, we've done over 100 telemedicine visits a day in the recent weeks. So with that being said, we need to remember that the test of any community's resiliency is how well it responds in the face of adversity. So for this next month, let's try to navigate through these crises. Let's weather this storm, and let's come out of it stronger than ever. Let's renew our spirit and energize our vitality, and be innovative in what we do and how we care for each other. And most importantly, Allen County, stay well. Thank you.
Thank you. Thank you to all of our speakers today. Appreciate your efforts coming down here. We'll open it to questions at this time for any one of the speakers, or at the conclusion of the conference, you can meet with them one-on-one. So, thank you all. Appreciate you being here and taking care of us. Thank you.